I am going to bring more of an NIH perspective because my role in the Center for Human Health and Environment, that is an NIEHS-funded center. So I'm glad to have Dr. Henry here representing the NIEHS. And so I think it's great that we have heard some people might say too much about environmental exposures and toxicants, but I think that is one of the most important levers this group can have to get money from NIH, because it has to have that human health component, and that may be the easiest way to do it. Another hat that I wear is I'm director of our Pediatric Healthy Weight Research and Treatment Center, and so my main goal and interest there is understanding the causes and consequences of obesity in children. And so that, of course, involves a lot of nutrition as our main tool and our behavioral tool, but we're also concerned about the role of environmental xenobiotics and obesogens in driving the obesity epidemic. And so plants and food bring both calories, sometimes excess calories, and may also bring xenobiotics or other compounds which may drive obesity. So my connection to this group is a little bit stronger than you might expect based on the fact that I'm just a pediatrician. Now, I may be the only pediatrician in the room that's actually had a soil science class. I'm a graduate of NC State, and I took a soil science class sometime in 1970. I won't exactly tell you when. And it had something to do with NPK and something. But what I really learned was that if you wanted to get a good grade in participation, you did not use the word dirt. So I have retained that in my deep muscle memory. Okay. All right. So I think we should end the conference with the way we began it from Dr. Paulson, which is with some definitions. So the definition of soil health, as defined by the USDA, is the continued capacity of a soil to function as a vital living ecosystem that sustains plants, animals, and humans. So let's just think about this in terms of sustaining humans, which I think is really the gist of this group and this excellent conference. And then human health, you can see there, is a state of complete physical, mental, social well-being, and not merely the absence of disease or infirmity. So you've heard a lot of comments. Yesterday's closer was a lot more active and energized than I am today. I don't think I can keep up with her, so I won't try. But she did show us a number of papers and publications that show that getting your hands dirty, growing soil, growing things in your own soil makes people very, very happy. Appreciate your comment about the sacredness of soil and other meanings besides food production. So I think there's a lot of latitude for looking at human health in terms of complete well-being, not just the absence of disease and infirmity. So when my former dean kind of got me into this, he was actually the invitee, but he couldn't do it, and he would do a fantastic job. So when Steve called me to give me the opportunity to participate, I thought just listening and standing up here and telling you what I heard would be very simple. So what I've tried to do is to synthesize what I've heard, or to categorize what I've heard. And I really think what I've heard here or learned here is that the way I would think about this is that soil health or soils, there's really kind of a dual nature to this. And soils I would think of as a matrix, and I would also think of them as a vector. And in the matrix, when we think of soils from the perspective of matrix, that's a matrix that sustains humans through sufficiency of the food supply. So we've heard a lot, and I think this is a very mature aspect of this group here, is how does healthy soil promote the sufficiency of the food supply. I also think it's a matrix that can increase the quality of the product and the nutrient content. So as someone who's concerned with good nutrition, obesity is a pro-inflammatory condition. I would like to learn more about how soil health can functionalize foods to make them healthier, not just from the standard NPK content, but also from the perspective of sulforaphane, other antioxidants, lycopenes, et cetera, that may help us better address some of the human health conditions that we look at. Certainly, as a matrix, soils are important for bioremediation and homeostasis. I learned a new term, ecosystem services. I think that's fantastic. Heard about biochar. I'd like to learn more about biochar. We have some research at ECU in another department around that. So I think that's really critical for sustaining human health. Not something I'm going to do as a practicing physician, but I understand the importance of it. We've also heard a lot about the microbiome, and the microbiome, I think, which gives the soil its living definition, so it can have health based really on how healthy its microbiome is. And then certainly I learned, and I think an important thing to take away from this conference is that the microbiome, soil, plant, human microbiome may be in a continuum that influences each other, and certainly human health is very dependent on the microbiome. And from my perspective in the obesity world, really I think the first evidence that the microbiome was really important in human disease were experiments demonstrating that you could transmit an obesogenic microbiome from obese animals to notobiotic or germ-free animals and transmit this obesity phenotype through metabotype that's associated with obesity. So this is a hugely important area that we're just scratching the surface on. Okay, so I'd say that's the good side of soils, and then let's get to the bad side of soils. So what I heard is that in some cases soils can actually promote disease. That may be through contamination with pathogens, and we learned a lot about that and the role of FDA in that. And then contaminants, so metals, and these metals may be metals that are naturally occurring, or they may be from anthropogenic activity. Persistent organic pollutants, PPCPs are personal care and pharmaceutical products, and in my neck of the woods, we serve a 29-county region that's mostly sandy, and as we know, sandy soils are not particularly good at handling anything. We have a lot of septic fields, and our surface water is contaminated with these personal care products that come out of these septic fields. So the properties of soils in my region and how they mitigate or don't mitigate these compounds, which include estrogenic, obesogenic compounds, is of interest to me as a practicing physician that's interested in things that influence obesity. So that would be an area I would be interested in collaborating on. And then the polyfluorinated alkyl substances, certainly an issue in our part of the world. Chemours facility is producing the one site that produces the 6-carbon Gen X compound, which is contaminating Cape Fear River water. We've just had 2 major flooding events. I'd be quite interested in knowing what our soils are contaminated with and how that may influence human health through this class of chemicals. Then certainly pesticides and pesticide residues that come in. And then I think one thing I didn't hear that I was interested in, we didn't hear, was more about nitrogen and ammonia. And in a region that has a lot of swine CAFOs, we know that ammonia plumes from these CAFOs cause potentially a lot of respiratory problems, and this is an under-researched area. And then if we apply these ammonia compounds or these nitrogen compounds to our soils, what is actually going to happen to them? Does that really mitigate the problem, or does it just kick the can down the road? And then there's also this overnutrition paradox. I think that was alluded to earlier, or misnutrition. And actually, the WHO says that now overnutrition and diseases related to overnutrition, particularly type 2 diabetes, are now a more important health problem worldwide than undernutrition. So this mismatch, and there's a mismatch, so I'm very interested in functionalized food. And then the CDC says that 33% of boys and 39% of girls born in the United States in the year 2000 will develop type 2 diabetes in their lifetime due to overnutrition and exposures. In our part of the country, where our pediatric obesity prevalence is almost twice the prevalence of the rest of the country, we're looking at 60 to 70% of all comers developing type 2 diabetes. So clearly, good nutrition, proper nutrition is really, really important in the overall public health of our region, our state, and certainly our country. So I would say we've also heard that we need to balance the issues of soil productivity, nutrient uptake, transport, and minimize that of these harmful compounds. So we need to maximize the good and minimize the bad. And then I think Dr. Burke put it very nicely, and this really dictates a systems approach where we understand the consequences and the unintended consequences of what we do. Themes. So themes I've heard: communication. So the subway occurrence. I don't know if the subway lady's still here, but the subway occurrence was she was standing beside a well-educated lawyer in the capital city of the United States and had no idea about the soil health issues and crisis, et cetera. We've heard we need to engage more stakeholders and engage social scientists, engage, and the stakeholders is really, really important. We heard from Dr. Henry that stakeholder engagement is crucial for EHS and NIH funding, and as part of our P30 center funded center, our community engagement and outreach core is really, really crucial. I also was hearing was that their soil and health and soil health and issues related to it, I really think of as very global, and we heard a lot about various levels, global, One Health, et cetera. But don't forget local. So I think what's really happening is I would imagine that my health may be influenced by the soil health in a faraway place where a lot of my food is coming from, or maybe even most of my food is coming from. So that's the matrix in action. But the vector in action might be what's in my soil in my yard that I'm gardening or that's in my wind. And so I think we need to think about this from both perspectives. And as I learned here, how many people will be living in a city, they're going to be more and more removed really from the soil health issues where their food is produced and more experiencing the legacy issues that we've heard about in terms of lead, cadmium, et cetera, et cetera. And so thinking about the dual nature of forces removed as well as very proximal influences. Certainly climate change is huge and absolutely right, that's going to drive a lot of the human health challenges in the near future. Heard a lot about sustainability and the importance of sustainability and sustainability practices in driving healthy soils. I really appreciated the FDA's approach of talking about practical solutions. If manure may have a bit of a hazard to it, we can't stop or bio-waste solids, we can't stop making it. So we just have to be practical and apply appropriate risk assessment and risk-benefit analysis. And then I think that goes back to then being able to communicate effectively how we do that and why we do that so that people can understand the policy. Mixes and mixtures. Yeah, this is really important. So somebody that's interested in estrogenic, obesogenic compounds, I'm well familiar with the concept that we need to study mixtures because we all live in a soup, not in the presence of a single toxin or stressor. So understanding how mixtures of toxic compounds interact and promote human disease is really important. We've also heard as a theme vulnerable populations, particularly children, but also older people as well have certain susceptibilities, and that's a growing population. So thinking about how your research might address those vulnerable populations might get you a leg up with a funder. Policy is really critical. So in my sphere of influence, and what I learned at this meeting was that, I already knew, of course, that 50% of your plate is supposed to be fruits and vegetables from the My Plate, but I had no idea that only 2.5% of land was planted in fruit and vegetables in the United States. And that's probably a little bit of a policy issue in the sense that I think there's policy that promotes the production of high fructose corn syrup, which is not the friend of my patients. And so cheap high fructose corn syrup is readily available. And so having some policy issues and rearrangements could be very helpful for public health. Funding, we talked a lot about funding. And I think I heard a lot of funding mechanisms that I am not familiar with, more agricultural. So what I would say from the funding mechanisms that I'm more familiar with, principally NIH, funding is that you really need to partner with someone in public health or medicine that can get their hands on cohorts and people and look at something, some outcome, some disease outcome or some health outcome that matters to that particular agency. Let's see, tap into existing data and resources. So we really need to get out of our silos and learn what's available and how to get our hands on other people's data and use that. So I learned a lot about that today. I'm not a big data guy, but I appreciate the power of it. And then once again, take a systems approach. All right, this is the only instruction I got from Steve, which was to tell you all one thing that I'll carry home and share with my medical colleagues. And that is, who knew that the properties in your soil of the place of your birth may actually program your stroke risk across the lifespan. And this is really fascinating to me, or very interesting to me, because we actually have a personal health program at ECU, Brody School of Medicine, in which we're looking at stroke risk. Actually, the one county over from Pitt County is actually the highest stroke rate mortality county in the entire country. So maybe we're not the buckle, but we might be one of a belt loop of the stroke belt. But what my colleagues are finding is that there is probably an epigenetic signature that's associated with this stroke risk. So wouldn't it be great if we could bring together this epigenetic finding with these soil health and soil finding and this GIS information that this room brings to the table that we never would have thought to look at. So with that, I will close my comments, but first, thanks, Steve, for talking me into coming and giving me the opportunity to come, and the planning committee for putting together a fantastic meeting. And I would say, let's see, a shout out. We are having a rural health symposium at ECU through the School of Medicine. And the rural health symposium, this might be a great place to highlight this kind of, the output from this meeting. Number one. Number two, if you want to reach physicians, you better make sure they can get some CME credit for their time. So I could help with that. So thank you very much.
Thank you very much.